it is critical that we address all of the needs of the patients, not just the physical. Attention to spiritual distress is a human right as much as attention to physical, emotional, and social issues. Ultimately, I think the foundation of a healthy, healing system of care is spiritual. My name is Christina Puchalski, and I am a physician, palliative care, geriatrics, and internal medicine. I am a professor of medicine at the George Washington University School of Medicine, and I'm the executive director of the George Washington University's Institute for Spirituality and Health, Gwish. We were chartered by the university in 2001, the first chartered university institute of its kind in spirituality and health. And our aim is to integrate interprofessional spiritual care into health systems globally, locally, but as a standard of care, as a way that we can address patients' spiritual issues as an integral part of their care. Spirituality is the way that we search for deep meaning, that ultimate meaning, purpose, and transcendence, and how we connect to the significant or sacred, however we understand that. For centuries, it was the shamans and the healers and the Native American medicine men and women and the religious leaders and the spiritual leaders that were very involved in the care of human beings. But there was a dissociation in that, and that happened in the early part of last century as science became more prominent for very good reasons. I totally respect science, but it seemed that we moved away from that more holistic approach, and there's a coming back to that. I think I was inspired to look at how spirituality plays a role in the life of patients. When I did some volunteer work before I entered into medical school, I was actually doing research and had actually a major loss in my life and was part of a women's bereavement group. And then we sort of spun off and had a spirituality group. We were all from very, very diverse backgrounds. And in my own life, I recognized how my inner life was so important to coping and healing and moving forward. When I went to medical school, I was struck by the absence of that realm in patient care. So I thought that this is, it's so key in people's lives. And I started thinking, well, maybe we need to learn more about this, and proposed an elective. And then we held an elective at George Washington University, which was so well received. Our elective then became integrated into the full curriculum. And I just started building on that until eventually we started working on guidelines on interprofessional spiritual care. And that's been a bulk of our work since then. Whatever discipline we're in, we provide good care, all care to the whole person, and by the standards in our profession. Every patient gets some sort of spiritual assessment. So what does that mean? If we find out about people's resources of strength, say their faith is important, or they meditate, or mindfulness is important, that gets written in the chart and gets supported if the patient wants that supported. If it's someone that is dealing with a lot of suffering and distress, that gets identified and attended to, not just identified, but and attended to. So ideally, I think there should be an interprofessional team. There should be ready access to spiritual care professionals in the outpatient as well as the inpatient setting. It's the choosing of our words carefully, and it's accompanied by our gestures of support and love. That's what I think we need to bring, and that's what I think spiritual care is. Spiritual care is ultimately respectful care. It's at the core of respectful care. Compassion is central to everything that I do and I aspire to. It's not that I'm always compassionate, and we all struggle. I'm a human being, but I aim for that. I aim for these values. I'm not always there, but I aim for them. Part of our recommendations in spiritual care is that our own spirituality is what brings us to this work. Yes, I'm Catholic, and I'm a contemplative Catholic. But my religion and faith is enormously impacted by the people around me and my experiences. My practice as a doctor is a spiritual practice. That's one of my spiritual practices. So I see it as not separate from my life, but very much integrated in it. I just recognize that this work in spiritual care is a calling, and that's why I stay on that path regardless of how many stones and other things are placed in front of me. I just keep on going. COVID is causing all of us a lot of distress in many different ways, some more than others, but none of us are are walking away from this unscathed. We've all experienced what some might term spiritual distress, others might term existential distress, psychological distress. We know suicide rates are up. It's a terrible time. The grief, the sadness, the unfinished business, the fear of what's next, and then all of the uncertainty during COVID. It's that deep suffering in our soul, for which is very difficult to understand, it's very difficult to quantify, but it sure hurts. It hurts a lot. And it is actually during this time that people are finally beginning to recognize the importance of spiritual care and spiritual issues. Let's say that we are, even now, let's say we feel a little better, we've gotten vaccines, maybe we feel better, we might not die from it, but there's a lot of uncertainty. And I think it's triggered a lot of reflection about what matters most. Maybe the upside of COVID is maybe our focus will be sharpened on what matters most. The spiritual domain is not just about distress, but there is such a concept as spiritual health, joy. Why is mindfulness such a powerful skill, if you will, these days, is that it does remind us about gratitude and the present moment, and how all our worries can distract us from the actual moment, and that we can have joy in the midst of despair. And I think ultimately the kind of care we're talking about holds a space for that.